Hello and welcome. Thank you for joining us today for our webinar, The Role of Bioactive Lipids in Inflammation-Resolution Signaling. We're excited to have you with us as we explore how these powerful molecular players are reshaping our understanding of chronic inflammation and its impact on health. I am Melissa Burback, Marketing Manager here at Echelon Biosciences, and I'll give a short introduction of the webinar topic and speakers, and then we'll dive right into today's discussion. Bioactive lipids are produced in the body as metabolic byproducts of the everyday fats that we eat. These molecules play crucial roles in regulating inflammation and tissue repair. As you know, chronic inflammation is a key contributor to a wide range of non-communicable diseases, including cardiovascular conditions and cancer. Today's session will delve into how bioactive lipids and immune cell signaling work together to resolve inflammation, promote cardiac repair, and prevent long-term tissue damage. We're thrilled today to be joined by Dr. Ganesh Halad, a leading expert in cardiovascular immunology, who will guide us through the latest discoveries in this exciting field, as well as Dr. Colin Ferguson, Vice President of Production at Echelon Biosciences. Dr. Ferguson has a Bachelor of Science with honors in chemistry and oceanography from the University of British Columbia and a PhD in chemistry from Queen's University. He was a postdoctoral associate with Professor Glenn Prestwich at the University of Utah, focusing on phosphoinositide and phospholipid synthesis. Dr. Ferguson has been with Echelon since 2001, where his experience in phospholipid chemistry allows Echelon to continually expand its product offerings and improve its operational efficiencies. He is currently Vice President of Production at Echelon Biosciences. Dr. Ganesh Halad is a full tenured professor in the Department of Medicine, Division of Cardiovascular Sciences at the University of South Florida, and is a member of the USF Health Heart Institute. His research focuses on inflammation and resolution signaling mechanisms in heart failure, dissecting the mechanisms of novel bioactive lipids in cardiac repair, and applying strategies to prevent, slow, or reverse the progression of heart failure. Dr. Halad earned his PhD in pharmacology from the University of Mumbai's Institute of Chemical Technology in 2007. He completed postdoctoral fellowships at the University of Texas Health Science Center in San Antonio, focusing on nutritional immunology and the effects of obesity on heart attack, cardiac structure, and function. Dr. Halad has authored over 105 scientific publications, and his work has been recognized with more than 25 honors and awards, including the American Physiological Society's Research Career Enhancement Award and the Article Impact Award for his studies on inflammation resolution in heart failure. Dr. Halad also serves as an associate editor for the American Journal of Physiology, Heart and Circulatory, and Scientific Reports. Now, without further ado, let's dive in. I will turn it over to Dr. Ferguson, who will give a brief introduction of Echelon Biosciences. Be sure to add your questions to the Q&A for discussion at the end of the talks.
Thanks, Melissa. I assume everyone can hear me. Yeah, so, oops. So Echelon Biosciences was founded in 1997 by two professors from the University of Utah, Dale Poulter and Glenn Prestwich, who were supplying phosphoinositides and isoprenoids that have been synthesized in the labs that were not available commercially. Since then, the company has expanded to include a wide variety of bioactive lipids in their catalog, lipids for LNP formulation, for RNA delivery, many different biology products, including specific lipids for, or specific antibodies for against lipids, which are quite, rare commodities, enzymes that metabolize lipids, proteins, and various unique biological products like our well-known PIP strips and inhibitors. In addition, we've developed many types of unique assays against lipid metabolizing enzymes such as PI3 kinase, autotaxin, lipid phosphatases, hyaluronic acid, and hyaluronidase. In addition, we have a wide selection of peptides, and we offer a number of custom services, such as custom synthesis, assay services, where we will analyze your samples using our assays. And then recently, we have started providing services for RNA synthesis and lipid nanoparticle formulation. Excuse me. What Echelon brings is decades of organic chemistry and lipid biology experience. Our catalog has over 1,200 research use only products. And as I mentioned before, we provide custom service assays, custom synthesis, assay services, and LNP formulation services. We've sold to over 1,300 customers around the world, and our products have been featured in over 6,000 publications. Most recently, we were purchased by Vion Biosciences and joined our sister company is Onge Biosciences, Bioassay Systems, and Aldon Corporation. And most recently this month, we've moved into a new 20,000 square foot facility, which allows us to increase our production capabilities and move into future GMP manufacturing capabilities for lipid synthesis and LNP formulation. Basically, all this sums up into Echelon's goal has really been the integration of chemistry and biology expertise to make research easier for our customers. We see this as essentially a three-step process. You have the synthesis of very complex lipids and other biomolecules. These lipids are then used for development of assays and other unique biology tools for research. And finally, applying these to formulation services such as for LNPs. So without further ado, we can move on to Dr. Halad's presentation of the role of bioactive lipids in inflammation, resolution, signaling, modulating health and metabolic diseases.
Yeah. Thank you, Colin. That's a great introduction. And so Melissa, I'll just share my slides and we'll get going. I'll confirm that whether you can see my slides. It's still loading. I think, okay. Can you see my slides, right?
Yes.
Yes, we can see it.
Yeah, yes. Perfect. All right. So as I mentioned, again, thank you, Melissa, for a kind introduction, and Colin, that's the great advancement in lipid science and lipid biology. So my goal is here next 45 minutes is to share what we have advanced in the context of lipid discovery, and also share one example of the cardiac disease, and it can be applied to the multiple diseases down the line in variable context or different types of lipid. So actually, these are the signaling molecules which kind of once used by the enzymatic machinery inside in the body, they make a number of small molecules, and those are more active than actually the fat or the structural fatty acids or the substrate. And they once the bioactive lipids form, they activate the receptors. So they go in a very sequential manner, and this is a kind of very conserved process in many species in homeostasis as well as in response to injury. But the key component is those lipids, or either the fatty acids or the substrate or the molecules come from the fatty acids, give a signal to that 1% of the immune cells. And I will also share which 1% I'm talking about, and those are either make or break our health every single day. So I'm talking about the 4 components, and those 4 components you can take either men or women's, and they transition from all the way young teens or babies all the way to the grandfather and daughter. Same way the fat also transition with the help of enzymes, and then forms bioactive lipids and activate. So, the four components changes the physiology of the macrophages. And in the similar fashion, even the macrophage also changed from one to the second form of macrophages, but this is the same macrophages show the different variety of markers depending on what type of diet, enzymes they express, and mediators produce, and what receptors are activating. So I'm integrating the immune function with how the molecules are formed, and in what context. Now, so this is a very simplistic view of those four component fatty acid used by lipoxygenase, cyclooxygenase, or cytochrome P450. Depending on the substrate or the enzyme, it will form the products and activate receptors. But this will be the one pathway, or just looking at the highway and not surrounding. But this intrinsic pathway or non-modifiable factor, which is going every single day inside the body, depend on the modifiable extrinsic factor, which is your diet, sleep, and exercise. And definitely, if these three are imbalanced, you will have a stress, which is very obvious. And further that, they give that signal to that 1% of the immune cells, how they can regulate or heal that damage associated molecular pattern, or pathogen associated molecular pattern, or lifestyle associated molecular pattern, or the aging associated molecular pattern. So all your molecular patterns depend on the function of these four components, which are going inside the body, or they decide the function of the immune cells. And in your day-to-day life, if this structure is imbalanced, they take you to the disease. And if all these four components are aligned, then we stay in the homeostasis. Now, as of course, this is just the primary slide to show you the long chain fatty acid. In reality, the fat is a saturated, monounsaturated, polyunsaturated, short chain fatty acid, and trans fatty acids. Here, more focused on, because these are the major component of our health as well as our circulation. And the omega-3 is essential. You find many products over the counter. At the same time, omega-6, they are in our processed food chain product. Many products are enriched with. And this is the balance. If they are in balance, we stay in a much better shape and healthy, and our immune fitness is working perfect fine. Now, the fundamental question is why these fatty acids or polyunsaturated fatty acids are called as essential fatty acids. This experiment done by this husband and wife, Bird, and what they find is if they remove every single fat from the body, from the diet of these rat diet, and then those rats died way earlier. And if they put 3 to 4 drops of the lard and they start surviving, indicating that the fat is very essential for maintaining the skin health and metabolism of the many organs, including the kidney, heart, and every single one. So that's how the term got into the essential fatty acid. And then down the line, we got lost how they are used by the immune system and forms a number of mediators. And here I'm taking the example of the cardiac injury. Now back to the 1% of the immune cells I'm going to talk about. Now, if you consider our body, 8% of the blood is there, and again it gets fragmented into the plasma and cells, 45% of the cells, and again refragment only the cells, then you will find less than 1% platelet, less than 1% of leukocytes and erythrocytes. And every time you visit either for healthy or unhealthy reason to the doctor's office, in clinical setting, they quantitate your leukocytes, how that CBC count, complete blood count, how's your neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So this is the most important component of your immune health that takes care of everyday injury, infection, or stress, or a normal wear and tear. Now, why? Now the question is why heart? The first beat defines the life on the planet, and the last beat exit from the planet. That's what I feel. The heart is very important. And like many organs, of course, it functions in the three ways. One is mechanical, another one is electrical, and then it has a unique plumbing. So all three systems are integrated critically and essential for. So first we will be talking about the intrinsic component that I have mentioned, the four components, how they are helping in a cardiac repair. Now, the heart failure is a process, a result of myocardial infarction. The myocardial infarction process begin way earlier, even in our childhood. If you are not maintaining the lifestyle, the plaque starts building from even the 2 years of age. And when we kind of not maintaining the healthy lifestyle, definitely we have earlier plaques, and that's why we are seeing more patient in younger age. Once this reached to the 60-70% blockage, or if you have any another stressor that leads to event of the myocardial damage, commonly called as a heart attack, leading to change in size, shape, and function of the left ventricle, and eventually heart failure. But the common thing happen in response to any event, either a stroke, a heart attack, or even ant bite, the immune cells come to the site of injury, and if they don't leave on time, that leads to the non-resolving inflammation, which is very common in aging, obesity, diabetes, hypertension. But if they come and do their job and leave on time, means the get out signal is maintained, that leads to healing or the cardiac repair. The fundamental question we are answering in the lab is, what is the root cause of chronic inflammation? And the sub question is, what fat does to the body? That commonly we talk on the lunch or dinner table, but we are asking another question: what body does to the fat once it goes in the body, especially in response to injury like heart attack? And what we notice as this diet or the fatty acids present in the diet used by variety of lipoxygenases and forms number of bioactive lipids and activate receptor in a sequential manner. And we have kind of produced number of evidence supporting this. And these all four components drive the quality of that 1% immune cells, which decides either make or break. Now, why we have to focus on chronic inflammation or chronic disease? Because inflammation is underlying in every non-communicable disease, chronic disease in America. 60% have at least one risk factor, whereas 40% two risk factor. And heart is the number one. Heart disease is the number one killer across the globe. And we end up with the 3, 4, 1 kind of underlying causes. One is poor nutrition, lack of physical activity. Even the sleep is not covered, but sleep is also important component, and other use of either tobacco or alcohol. These are kind of quite modifiable factors. Now, we'll ask the question, why do mice heal after the heart attack? And I'm asking healing because here I want to show this video, and you have to take my words. These are the chronic heart failure mice. If you see here, this heart is absolutely not moving. The contractile index is less than 10, and the normal mice is between 40 to 45. This is the control mice, and their actually physiological movement is very similar to the normal mice. Means they showing the sign of cardiac repair. But if you see in patients, there is always these fatigues, activity limitation, congestion, edema, and shortness of breath. You are not seeing these symptoms in the mice, but they are heart failure. Okay. Now, that's why I feel saying here the cardiac repair is feasible in mice. The question is how? Now, in response to injury, as the ant bite is there, the red things happens, then the immune cells travel to the site of ant bite. Same way, if we give a heart attack to the mice by ligating the coronary artery, the artery which supplies blood to the left ventricle, we block it almost 70 to 80%. That time immune cells, this is no heart attack mice, very few patrolling immune cells are there. Those 1% leukocyte, just less than 1%, they are present. But as soon as the injury is there, more number of immune cells arrive at the site of injury. Also in the spleen, those are activated. I mean, two things are happening. Your immune cell get activated and they start aggregating where there is a problem. And then there is a further expansion of, so this evidence suggests that as soon as there is injury, the immune cells come there, especially the neutrophils and macrophages. And here the graph showing that the LV is showing higher number of macrophages, which is F480 positive. Now, the second question, what these leukocytes carry with them, and what we notice is that in naive state, there is a fatty acid, but in response to injury, they are bringing huge number of fatty acids, both one in the heart as well, infarcted heart, as well as they are increasing in the spleen. Means the human body is designed to back up with another system because the spleen is reservoir for supplying the immune cells. So here you are seeing the DHA is increased, likewise the arachidonic acid is increased, and the EPA is increased in response to injury at the site of infarcted site. Now, the next, obviously, at day one is the critical time after the, what functions do the leukocyte perform at the infarcted site, because they got the fatty acids and the immune cells are there, and they express the unique enzymes, immune responsive enzymes like lipoxygenase and cyclooxygenase. Here you will notice that the heart, infarcted heart, injured heart, they express high levels of lipoxygenase 5, 12, and 15 compared to spleen. And here you will notice that cyclooxygenase 1 and 2, that open circle, they are higher in the spleen, whereas the LOXs are in the heart, whereas the COXs in the spleen in response to cardiac injury. Obviously, this is, bear with me, this is a busy slide, but the point is very clear that in absence of injury, you have the fatty acids and the molecules, bioactive lipids, sitting in the spleen, and they are higher in the spleen, but not in the left ventricle because there is no injury, only 4%, whereas in the spleen, 13%. As soon as there is injury, within a 24 hours, the spleen bioactive lipids are depleted and move to the heart, because that's where the immune cells are traveled in response to injury. So that 4% is transitioned to the 18%. And then further, there is expansion from 18 to 20%, and the spleen regained back to 13%. In short, as the immune cells are traveling from the reservoir to the heart, then these immune cells, with the help of fatty acids, make number of bioactive lipids. Even this is a small, but these all bioactive lipids, majority coming from omega-3 fatty acids, EPA and DHA, in response to injury, especially at day one, and few pro-inflammatory lipids such as leukotrienes, prostaglandins, and thromboxans. So, in short, what I showed you, the young and risk-free mice develop heart failure functionally and structurally, not physiologically, because these mice are moving perfectly fine with limited signs of the heart failure, like edema and congestion. But if I take out the immune cells, then these bioactive lipid mediators are not produced, and mice will die because of heart failure, rupture, or the impaired cardiac repair, suggesting that two components are very important: the immune cells and biosynthesis of lipid mediators. Now, we have always that dilemma whether the gene is important or the environment important, and we did two really distinct experiments to make the point that one, we put the mice, which is BW mice, where they develop spontaneous lupus. This is chronic inflammation model. And if we put those mice on the DHA enriched diet, then they survive much more longer compared to corn oil, which is omega-6 diet, suggesting even if you have a chronic disease, then you can delay the progression of disease with the help of diets. And this is a genetic component. And if we take the environmental side, even the mice fed with the DHA, and if we subject to the myocardial infarction, then with the help of DHA, they survive better. And that is monitored till the day 28, which is, if we translate for the humans, is 5 years after the heart attack. Now, as in cardiology, we have kind of started getting the consensus rather than one single gene. The coronary heart disease is the result of polygenic inheritance, where many common metabolic genes, I'm emphasizing very specifically metabolic gene variants, how the fat and the immune system interact, that actually predict the risk rather than just very one rare variant. So you can impact the genetic risk. It's not finite. And this is very classical example. What do you mean by you can delay the progression, even delay the progression of chronic diseases? You are genetically predisposed. So in this homogeneous population, this is New England Journal paper where what they have did in they identified very homogeneous population. They are predisposed to cardiac disease, and monitor systematically for those who are following healthy lifestyle and unhealthy. What they notice, those individuals who are following healthy lifestyle, they have delayed the progression of the disease, whereas unhealthy, they develop the earlier disease, suggesting that the healthy lifestyle can delay the coronary heart disease despite of the genetic predisposition. In the context of omega-3, and this is a clinical trial, reduce IT, that if they use the high dose of the omega-3, they can delay there is a delay risk of the primary outcomes such as myocardial infarction, cardiac unstable angina, and variety of cardiovascular disease, including the stroke. There is also a secondary benefits like overall cardiovascular health is much more better without. There are some kind of complexity indicating the use of right placebo, but still overall there is a positive outcome depending on how this is used in the patient population. For that one, I'm providing some evidence how this omega-3 works and in what cases possibly it don't work and what could be the reason. Now, for that one, we have designed very simple study in the mice where the mice were placed on the omega-6 diet. Here I just want to emphasize, this is not a high-fat diet with the saturated fat, but this is the hidden fat in our many processed food diets, such as the safflower oil, corn oil, and that we use. And then once those mice, here we intervene, again transferred to the DHA, and one group continuously maintained on that same safflower oil diet, subjected to the coronary ligation, and then selected the time points like day 1, day 5, and day 28. The most important, we worried about the survival, and which is the key. So the DHA fed mice, which is a docosahexaenoic acid, one of the omega-3 component, it's showing much more better survival outcome compared to the safflower, which is omega-6. So if you see the baseline mice in the absence of cardiac injury, you will see the structure is wall is thick, but within 24 hours, the left ventricle wall, the one which is the main pump of the heart, which is thin, and again there is further wall thinning. Means both the group receive the same amount of injury insult, that you can see both having the same fibrosis, which is very compact fibrosis by day 56, whereas you will see the patchy fibrosis at day. suggesting that the heart failure progression is the same for mice, but the survival is much more better in the omega-3 fat mice. Then what kind of the bioactive lipids are produced? Here is the conclusion that suggesting that the quality of fatty acids define the quantity and quality of resolving mediators. Those mice which ate fed with the omega-6 diet, they have high pro-inflammatory mediators like prostaglandin, thromboxane, and leukotrienes, whereas the mice fed with the DHA, higher levels of the molecules coming from the resolving DHA, such as DHA-derived molecules such as resolving D1 or series of resolving myrcene, and even the EPA-derived EP3, resolving E3 is increased. Now, next question we ask, are these enzymes, are these resolving mediators enzyme dependent? The answer is yes. For this one, we test the hypothesis whether aloxify-derived leukotriene B4 is directly involved in impaired cardiac repair and promote heart failure. And this is very well studied, leukotriene B4. In fact, the Ben Samuelson and other two colleagues received the Nobel Prize for the leukotriene's discovery with the other molecules, thromboxanes and the endoperoxide. So the fatty acids present in our processed food, such as the safflower oil, that get transition to linoleic acid, and then linoleic acid to arachidonic acid used by aloxify lipoxygenase and makes LTB4. But this LTB4 formation is only dependent on in response to injury or infection or stress. This is the key point, but it's present in the reservoir like a spleen and lead to heart failure. So this is a very small snapshot of this complex pathway where the fat get used by COX, LOX, and CYP pathway. Now, if you see the mice don't have a lipoxygenase and also the wild type subjected to the coronary ligation, and you will obviously see that there is a continuous progression of the heart dysfunction and wall thinning. Here you are seeing the wall thinning and necrosis in both the groups, and this histology is nothing but the middle piece of the left ventricle looks like a donut, but the wall thinning suggesting that we have confirmed the myocardial infarction in both the groups same and monitored for a long time. Here is the surprising outcome. The mice don't have lipoxygenase enzymes. More than 70% or 80% might died within day 5. And another reason, the main reason of the death is impaired cardiac repair, means their left ventricle will burst out and rupture, leading to the accumulation of blood in the thoracic cavity. Like 60%, 65% of mice will die because of the cardiac rupture, suggesting that the aloxify null mice are not healing on time. The reason is because aloxify is critical for biosynthesis of resolution mediators, and the quantity in the injured heart is much more lower in the lipoxygenase 5 null mice compared to the wild type, both in the heart as well as the spleen, suggesting that aloxify is very critical for the, in opposition or in contrast to the resolution mediators. If you notice, the pro-inflammatory mediators much higher in aloxify null mice that are ruptured or don't have a cardiac repair, both in the heart as well as in the spleen, especially at the D1, especially prostaglandin E2. Now, this was our hypothesis. We started with that if the leukotriene forms the heart failure, but the leukotriene is just inviting signal because of the lipoxygenase 5, but at the same time, it also involved in the use of DHA omega-3 components and formation of the resolution mediators and leading to the cardiac repair and protective role means aloxify is a very critical balancing of both inflammation and resolution signal for the cardiac repair. Now, what is the role of these resolving mediators in the cardiac repairs as from the therapeutic point of view? So what we did is we used one single resolving D1 mediators and injected to the mice after a myocardial infarction, 2 hours after myocardial infarction. What we see is there is increased levels of resolving D1, D2, myrcin-1 and lipoxygenases, means there is a ripple feed-forward effect. If you inject one resolution mediators, it's amplify the biosynthesis of other resolving mediators and help in activation of this resolving D1 receptor formulin peptide, which regulates the function of macrophages in safe clearance of inflammation. The next point is the receptor, that the formyl peptide receptor that I mentioned is of the resolving D1. It's open up the site of action and facilitate the macrophage function, and we studied the role of the FPR2 resolving receptor by using the whole body knockout, and we have a very interesting outcome. What we see, if you subject these FPR2 knockout mice for the coronary ligation, cardiac injury, then you see that the immune cells coming to the site of injury from the spleen is delayed. That is one thing. And the second thing, the macrophages, they perform the action of the cardiac repair by making the bioactive lipids with the help of those lipoxygenases, including the 5-lipoxygenase, that is decreased. We see the decrease 5-lipoxygenase, resolving D4, myrcin-2, and lipoxygenases because of just the non-function of the receptor, leading to the non-resolving inflammation. Another surprising component we find, if these mice becomes old, just for like 6 or 7 months, they become obese and they have a kidney inflammation and showing the marker of NGAL, KIM1, neutrophil gelatin associated lipocalin, the kidney injury marker 1, fibrosis, and showing the cardiorenal syndrome. It means the receptor is a key component. So here I'm sharing slightly more comprehensive data and slightly different interpretation that these mice, 2 months, you see the body weight slightly higher, but that difference is very clear. Those FPR2 null mice, which is resolving D1 receptor, and you see by day 7, these male mice have a higher body weight. Obviously, you can see in the dual X-ray absorptiometry, the higher fat mass. So this is the model of heart failure with the preserved ejection fraction. Even their heart function is normal, but you picked any organ, you will find the inflammation, including spleen, heart, kidney, adipose tissue, leading to cardiorenal inflammation and leukocyte dysregulation. Whole immune system is dysregulated, and signs of the obesogenic aging and the heart failure with the preserved ejection fraction, which is now the epidemic because of the obese population in USA and across the globe. Now, I'm more leaning towards the second component on the same thing, the intrinsic component, that 4 components I mentioned, the fatty acids, enzyme, lipid mediators, and receptor I covered. Now I'm going to the extrinsic components apart from the diet. Now, how does the heart respond to the extrinsic or the modifiable components? And we know that almost 26 years of our life we spend in the sleep. And now if we don't sleep, what happens? That's what I'm sharing with you, that how the sleep and diet interact with the theme of the diet used by the fatty acids and how the bioactive lipids are formed. So this is our study design where the mice were maintained either control or lab chow diet or the obesogenic omega-6 diet, and then subjected to the sleep fragmentation. This is the mice, the nocturnal, they sleep during the day and wake up in the night, and we put them during the daytime in the chamber, and this rod will move back and forth every 2 minutes, so it will disrupt their sleep and they will not get the sleep for 3 days. This is acute sleep fragmentation. And then we subjected those mice to the coronary ligation and study the multiple components, including lipid metabolism, microbiome, and inflammation resolution signaling in context of the synthesis of bioactive lipids. So if the sleep superimposed on obesity or the processed food intake, then there will be a lack of SPMs or specialized pro-resolving biosynthesis and increased pro-inflammatory lipid mediators. So this bubble plots is showing that when there is no sleep fragmentation, means the control, we are seeing the bigger dots, means the more cardiac repair molecules are formed. In contrast, if there is a sleep fragmentation, the smaller the dots, means the smaller the quantity of these bioactive lipids, commonly called as specialized pro-resolving mediators from the omega-3 fatty acid. In contrast, if you see the pro-inflammatory mediators like the prostaglandins, thromboxanes, and leukotriene, especially the prostaglandins high, when there is a sleep fragmentation is there, as compared to the control. So suggesting that if there is a sleep fragmentation, that impact on your immune system as well as the biosynthesis of lipid mediators, especially in response to injury. So what the brief outcome of the sleep study is, without risk factor, inflammation and resolution is balanced. But as soon as we add the risk factor of the obesogenic diet as well as the sleep fragmentation, there are a variety of genes, especially the immune responsive genes are changed, and they change the biosynthesis of lipid mediators. Where there is injury, of course, there are changes in circadian genes as well as the genes which are present in the spleen. Now, the next is a very obvious risk factor as the sedentary lifestyle. So we ask another question: how do the obesogenic diet and exercise impact on resolving mediators? So we continue the theme of using the omega-6 diet and added the component of exercise, but here instead of the diet time, we have really used a long time because of the COVID kind of impact. So the mice were fed 10 months on the omega-6 diet and maintaining the control, and then transition or randomize to 2 weeks exercise regimen. This is voluntary exercise, maintaining their respective control, obesogenic control as well as the sedentary control fed with the control diet, and study the various bioactive lipids. Of course, the mice with omega-6 diet for 10 months, they have relatively less voluntary exercise. And we know that, okay, if those individuals who are kind of using unhealthy diet, they have relatively compromised exercise capacity. So here is the key component, just the like inflammatory mediators. If you see that the obesity is enough to increase your inflammatory mediators, that is very well known. But if you are exercising, you can take down your pro-inflammatory lipid mediators, means definitely the exercise has a benefit, means even though it is a voluntary wheel in the cage, but the mice were doing the exercise, and this gives a very good indication that the exercise regimen worked for the mice because of we see the pro-inflammatory. Here is the fundamental thing. What we see in response to because of the diet, the resolution mediators are lower, so they cannot go up even there is exercise. But just because of exercise from the control mice, you are seeing increased resolution mediators. Means exercise is helpful only if you are maintaining the healthy diet. You cannot cover up or patch up by maintaining the obesogenic diet or processed food habits for the better outcome from for the exercise. Now, question is, how can this approach be applied to the heart failure patients? And for that, we use slightly different approach. Here we selected black, white, male, and female, all those four groups, and make sure that they have all uniform LDL, no changes in their different lipid levels, and ensure they have a ST elevation, heart attack. And then we use everyone has a MIA STEMI patients, and then we use the same protocol for quantifying the bioactive lipids. So what we notice is that there is no differences in their LDL, HDL, triglyceride, and cholesterol, but we see the bioactive lipids, especially the resolving E1, is relatively higher in the white patient, both male and female, compared to the black patient. And we know from the reports and observation that culturally, the African American, they have relatively more intake of the processed food, as well as they are more keen to their food preparation, relatively use of the different types of the fat. So in short, what I'm showing here, in case of even in the humans, the inflammation and resolution, which is a safe clearance of inflammation, these both processes start as soon as there is injury, because all the samples obtained within 24 hours after the heart attack in the human patients. Now, so far, what I have shown you, I'm kind of trying to infographics and put it together. When these three components, your diet, sleep, and exercise, is balanced, that time, what happened is that immune response is coordinated very precisely. What happened, especially in response to cardiac injury, immune cells from the spleen come to the site of injury, use the fat, and makes the biosynthesis of specialized for resolving mediators, which is omega-3 products of the as a bioactive lipids, in which the immune cells get in signal, transit time, and get out signal is very well calibrated. Means inflammation and resolution is very well calibrated, leading to cardiac repair. In contrast, when we have added either sleep fragmentation or obesogenic diet in control, or the sleep fragmentation, then what we are seeing, the inflammation is much more higher compared to resolution, because of the deficiency of those bioactive lipids coming from omega-3 fatty acids. And in that time, then these immune cells, that 1% immune cells, either they are not coming on time, or their transit time is high, or their get out signal is compromised, leading to chronic inflammation and deficiency of resolution. So here I want to take opportunity to use the quote of father of cardiology for prevention of cardiovascular disease, and he actually founded the whole field, the prevention cardiology, and he mentioned the three things like walk more, eat less, and sleep more, that back in 1924. And now we have the same thing coming up, and nowadays that you have a pill, the diet, exercise, and sleep. If you balance it, that's the health, and if you imbalance it, that's the disease. And now if you go really 5,000 years back, and I see this quote in Sanskrit language, the meaning is, if you balance these three things, diet, sleep, that's real yoga, not only the positions. If you do the positions of yoga, it's icing on the cake. But if you imbalance it, that's called as over pleasure or bhoga, that definitely leads to disease called as a roga. So in summary, what I have shared with you that the coordination of 4 intrinsic factors is essential for homeostatic metabolism and resolution mediators. In that one, aloxify is essential for SPM's biosynthesis and cardiac repair using omega-3 fatty acids. An imbalance of 3 intrinsic factors, diet, sleep, and exercise, lead to impaired biosynthesis of resolution mediators, whereas the dysfunction of resolution mediators, especially the formyl peptide receptors, lead to multi-organ chronic inflammation and heart failure with the preserved ejection fraction. Here is an acknowledgement. Here I have a very small team members. I collaborate a variety of USF and non-USF faculty. Charlie Strahan is leading the discovery of resolution medicine. One of the previous colleagues, Sumant Prabhu, my postdoc mentor Mary Lindsay, and Gabriel Fernandez, one of the postdoc mentor, and many trainee participated in this one. And I have active collaboration with Hokkaido University, Dr. Gowda. So with this one, I'd like to thank you everyone for joining, and thank you all. I'm happy to take any questions.
Thank you, Dr. Halad, for your insightful discussion. Now we'll open it up to the Q&A session. Be sure to click the Q&A button at the top of the toolbar to enter your questions. We have one question came in. If omega-6 fatty acids lead to an increase in pro-inflammatory lipids, what do saturated fatty acids like palmitic acid lead to?
Yes, this is an interesting question. Even you are taking the saturated fat, it also push the polyunsaturated fatty acid metabolism and leads to activation of the cytokines and dysregulate polyunsaturated fatty acid metabolism. Very similar the way you take the PUFA.
We have another one here. How does age affect resolution?
Interesting question. We published in 2018 if we feed the mice with the young versus old, and then the old mice, by age itself, your lipoxygenase capacity is lower. So it means the fat may be the helpful early in life, and later in life we should be calibrated. So if the resolution capacity is going lower with age, by age itself, even if you are on controlled diet. But if you go on the obesogenic diet, then there is much more dysregulation or high impact on lipoxygenase and high activation of cytokines like TNF-alpha and IL-6, suggesting the age has a tremendous role on both biosynthesis of resolution mediators with the help of lipoxygenase, as well as the immune function, the capacity of the leukocytes, especially the macrophages, using the substrate is declined overall.
We have another one here. Did you ever measure increases in cytokines for diets of omega-3 versus omega-6?
Yes, we do. We have. I have not get the chance to present all the cytokines data, but in our both the papers, cytokines come much more later compared to the eicosanoids or bioactive molecules. Actually, the bioactive molecules drive the kinetics of the cytokines. If you see the TNF-alpha and IL-6 or IL-1 beta or any other, as on today, there are around 133 cytokines, but we are kind of focusing few, which we are categorizing either pro-inflammatory or anti-inflammatory, like a TGF-beta and all, and we see huge changes because of the omega-3 and omega-6 diet. Especially omega-6 diet is driving here. Also, I want to make a caution. I don't want to say that the omega-6 diet is absolutely bad. I want to say that the right dose in the medicine, right dose defines whether it is a medicine or poison. So in certain amount at the right time of age, we need all the diet, these omega-6 and omega in balance. But if they are higher, then we see the high pro-inflammatory mediators.
I have another question that came in for Colin, for Dr. Ferguson. Does Echelon support the detection of unique lipids like bioactive lipids such as PGE2?
Sorry, excuse me. Currently, we do not have any a PGE2 assay. We are going to be developing a couple different prostaglandin-based ELISAs, and we hope to have them out later this year.
Just want to comment. We have a method for all the bioactive lipids, one single method, and we can quantitate by using the LCMS. So it's very quantitative, very precise, and we have a system in place if anyone is interested.
Very good. Any other questions coming in? I have one. Do different tissues have different expression of enzymes needed for resolution?
Yes, definitely. We see these immune responsive enzymes, they are densely packed in the spleen, and this is a very surprising finding. Nobody cares about the spleen. I said, why should we focus on that? But that's the real magic, because all your immune cells are sitting there just waiting for, is there any problem? And as soon as there is a problem, then they bring the fatty acids and the enzyme with them, and they make the bioactive lipid. And each tissue has its own unique use of not only the enzymes, but also the fatty acids. And here is what I have kind of learned from my experience, especially for the heart, the EPAs are much more densely packed in the heart. In the brain, DHA. And there is different enzyme system. Means each organ has its own unique utilization of fatty acid and formation of biosynthesis lipid mediators. So the answer to your question is yes, the resolution mediators are completely different for each organ, as well as the enzyme system.
Well, that's it that we have for now. Anyone want to be sure to anyone last minute questions? You want to drop them in? I think we're coming up on time. I just wanted to say a big thank you to all for joining us today and for your time and engagement. We've covered a lot of ground, and we hope that you found this session valuable. Thank you again to our presenters, Dr. Halad and Ferguson, for your time, expertise, and engaging presentations. In case you missed any of today's presentation, we'll forward a copy of the recording soon. We encourage you to visit Echelon's website for more product information and future event announcements. Watch out for details regarding our next webinar, using single-cell RNA sequencing to identify novel lipid nanoparticle candidates, with Dr. Kalina, co-founder of Nava Therapeutics, this August. Feel free to reach out with any further questions, and thank you again. Have a great day.
Thank you, everyone. I appreciate Melissa, Colleen, and the head. Yeah, thank you.
Thank you.